Hi, it's Dr. Shepard with Integrity Chiropractic. I wanted to take a moment to explain how care in our office works. So many of our patients have already been to other chiropractors, so they know what it's like to get adjusted, but what we do in our office is very unique and different from other chiropractors. Now, of course, we're going to adjust your spine, but what we do in our office is actually change the structure of your spine to create a stronger, more functional spine. So Dr. Leatherman and I are credentialed in chiropractic biophysics, which gives us the knowledge of how to change the structure of the spine, similar to using braces on your teeth. Now, in the next few minutes, I'm going to explain how the structure of your spine affects your overall health and what is needed to actually fix that spine so that you can do those things that you need and want to do for years to come. Now, many of us know that the nervous system controls all the functions of our body. So for everything from me moving my hands and speaking to you to involuntary functions of digestion, lungs breathing, heart beating, everything is controlled by signals being sent from the brain down the spinal cord to the rest of the body. Now, the spine protects the spinal cord. So when we have traumas throughout our life, and it could be a major trauma like a car crash or a sports injury, or even poor posture, sitting at a desk, carrying children in one side. All of these actions cause the spine stress. Now, with time, our spine starts to shift away from its normal position. As that spine shifts, it puts stress on the spinal cord and the nervous system. Now, in the short term, it might feel like your joints are restricted, fixated, like they're not moving very well. But in the long term, we start to see organ dysfunction as well. So the spine should have specific curves. It should have a backwards curve in the neck, a forwards curve in the mid-back, and a backwards curve in the low back. This creates a spring-like mechanism to dissipate force and take stress off of the nervous system. So let's talk about the neck to begin with. So you should have a 42-degree backwards curve in the cervical spine or the neck. This gives us full range of motion of our neck, as well as puts minimal stress on the joints, the discs, as well as the spinal cord. Now, what happens is we start to lose that curve. Well, our spine starts to have added stress. Instead of having a spring-like mechanism in our spine, we start to have compression into the neck. Now, our body reacts by laying down added bone, and it's oftentimes referred to as arthritis. Now, where that bone is laid down, we start to have compression of the disc, compression of the nerves, so you start to experience things like numbness, tingling into the arms and the hands. We start to feel muscle spasm into the shoulders and the mid-back. And then in the long run, we start to see things like vertigo, hearing disturbances, all of these things that are connected to the cervical spine or the neck. Now, this is the patient, as you can see, that has arthritis or degeneration in the lower part of the spine, but in the upper part of the spine, those discs are healthy, those bones are nice and square shaped, just like we're looking at. So oftentimes I'll have patients say, I know I have arthritis, my doctor already told me that. It's just because I'm getting old. But aren't the bones in the bottom part of the neck the same age as the bones in the top of the neck? That is because degeneration is related to biomechanics and structure, not necessarily age. So in this case, this patient was experiencing numbness, tingling into the hands, which many of our patients do. So it's vital that we take a look and fix that structure. I'm going to go into detail about how we do that in just a moment, but I want to talk about the low back as well. Now, low back pain accounts for the most days missed work, accounts for the most amount of medical care that's put into the system. So low back pain is a big issue. Now, what I often see is rounding in through the mid-low back, and we lose that nice backwards curve, as is the case with this patient. So it looks very much like a seated position. We get this rounding in our back, and we start to see those compressive forces take place, and arthritis occurs. Now, this is a patient that had chronic low back pain, but he also had significant digestive issues. He had gastric reflux to the point that he wasn't able to lay back when he slept at night, so he had to sleep on a wedge. So we were able to push his spine forward, really decrease what we call segmental buckling, where that curve is reversed, and his symptoms improved. His pain went away, his digestive issues went away, but there is work to be done. Now, your spine your spinal cord controls everything throughout your body. So when it gets the input that it needs and wants, it will respond quickly. That's why we see patients get out of pain fairly quickly in our office. But our goal is to fix that structure so that the function improves throughout your life and you're able to continue doing those things that you need and want to do. So how do we fix the spine? Well, we use a combination of adjustments, of course, because we want to break up scar tissue, help those joints move better. But what do those joints want to do right after that adjustment? Settle right back into that comfortable position where they were. So we use mirror image exercise as well as spinal traction to change the structure of the spine. Now, we'll go into detail about the mirror image exercise with you in your individual report, but let's talk about traction. Similar to putting braces on your teeth, the spine requires a sustained amount of pressure over time to really change that spine. So we have traction devices that are specific to the neck, the mid-back, and the low back, and specific to your spine to gradually change and take pressure off of your spine and nervous system. Now, how long do these processes take? Well, randomized controlled studies have shown that spinal changes to completely change the spine takes about a full year to occur. We start very conservatively with 3 months. In those 90 days, we expect to see 20 to 30% of improvement in spinal curve. That means that that red line that we see on our x-rays will be pushed towards the green line, but it's not going to be perfect. Now, after you get your braces taken off, they give you a retainer. We also send you home with a Denarol, which is a home orthotic used behind your neck, your mid-back, or your low back to continue those changes at home. Now, consistency is very important when we talk about structural care. So we see our patients 3 times a week over those 90 days, so a total of 36 visits, because that spine needs continual reminders of where it needs to be. Now, in between visits, the expectation is that you're using your orthotics every single day to continue those changes, because when we take x-rays at the end of those 90 days, we always know those patients that have been really diligent with their care. Now, this is a proactive approach to health. Our goal is to prevent you from relying on other doctors throughout your life. We want to prevent surgery, prevent the use of chronic medication use, and create a stronger spine so you can continue to do those things that you need and want to do for the rest of your life. Now, for those of you that just want to get adjusted, we do that as well. You've been to other chiropractors. Your goal is just to get that spine moving, feel better in the short term. We can do that as well. But I will tell you that I've seen patients over the years that have spent thousands of dollars and spent years, and they continue to suffer from those same symptoms that they were suffering from before. So my goal is to help you take control of your health. Now, we're going to sit down with your individual report and go over those with you, because everyone's spine is different. These guidelines are going to be dependent on how much degeneration you have in your spine, whether or not you have congenital anomalies, whether or not you have significant biomechanical changes that make it more difficult to change the spine. We want to make sure that we cater our care to you, because every patient is distinct and different from the patient next to them. So when you sit down with us, we're going to be going over specific timelines for your spine. What are your goals? Because ultimately we want to know what your lack of health is preventing you from doing in your life. We're also going to be going over your specifics of care, how we're going to get you feeling better in the short term and then be better in the long term. So we look forward to sitting down with you, going over your x-rays, and talking about your health goals.